The government says people who were vaccinated against COVID-19 8 months ago will need a booster. That decision is based in part on blood tests that show antibody levels in vaccinated people decline over time. Some of those tests were done at the University of Texas Medical Branch in Galveston, Texas. In part because of the special facility that's there, in part because of a test developed there, and in part because of a personal relationship between an executive at Pfizer and a professor at the university. The UTMB campus is a mix of old and new buildings near the north end of Galveston Island. Virologist Pei-Yong Shi moved there 6 years ago from Singapore, where he worked for the drug company Novartis. He was drawn to Galveston because it has what's called a BSL-3 facility, for biosafety level 3, a special lab that allows researchers to safely work on dangerous viruses. At the start of last year, Shi had been working with the Zika virus. But when the coronavirus appeared, he asked the Centers for Disease Control and Prevention to send him a sample so he could work on that virus. It didn't take long for the CDC to comply. Shi remembers a call from a colleague. He told me, "The virus is here." And that's the day we started the work, 5 o'clock, February 11th, Shi says. She planned to make a neutralization assay, a blood test that would show whether a particular drug or vaccine could stop the virus from infecting cells in the lab. A successful test wouldn't be a guarantee, but rather a good indication that the same drug or vaccine would stop the virus from infecting people or making them sick. To run the assay, you take cells grown in the lab, they happen to be cells that were originally derived from monkey kidneys, and mix them with the coronavirus. Then you add serum from vaccinated people. If the serum contains antibodies to the virus, it will prevent the virus from infecting the cells. If it doesn't, the virus will infect the cells. One of Shi's tricks was to speed up this test by adding a fluorescent tag to the virus. If the cells became infected, they would glow. Shi started working on his assay as soon as the virus arrived. We developed the system just 42 days later, he says. And then I remember March 26 is the first contact with Pfizer. Pfizer, along with the German biotech company BioNTech, had developed a new kind of vaccine, and to test it, they urgently needed an assay like the one Shi's lab had created. The key thing is that the assay requires BSL-3 containment, says Phil Dormitzer, Chief Scientific Officer for Viral Vaccines at Pfizer. At that time, we didn't have it. And there was another factor working in favor of a collaboration. Before joining Pfizer, Dormitzer worked at Novartis, where he had worked with Shi on occasion. When Dormitzer found out that Shi had the right assay and the right facilities and could do the work, he was delighted. "It is very good to work with someone you know and trust," Dormitzer says.